Hi everyone, welcome again to the English webinar of Skully Care. Today we will talk about measuring and treating babies with a Plagio and Brachycephaly. So if you are treating babies with a skull deformation, then you're definitely up for an interesting evening. But before we start, I would first like to introduce ourselves. My name is Freek. I'm the co-founder of Skully Care. And my background is in mechanical engineering, so it has nothing to do with skull deformation. And my role within Skully Care is development and management. And today I will host the webinar together with Katarina.
Hi everyone. Hi, I'm a project manager at Skully Care, which means I get to be involved with a bunch of different things, which is constantly changing and incredibly exciting. And I also work very closely with the international users, which would hopefully be you guys. I studied artificial intelligence and I specialized in health and cognitive science, and now I get to work with Skully Care, which is very good.
Thank you. And also joining us is Ellie. Ellie had some issues with her internet. I don't know if that's resolved now.
Solved.
Solved, perfect.
Everybody. I'm a pediatric physical therapist and I have a private practice in the Netherlands. And I have almost 30 years of experience in assessing and treating babies with skull deformities. So for the more difficult questions, you can ask me.
Yeah. So Ellie is also the co-founder of Skully Care. Me and Ellie started Skully Care, I think, 4 years ago. The first 2 years were quite tough with development and finding out what is the best way to solve some issues. And now we are the most commonly used way of measuring skull deformations in the Netherlands. And we are quite fast growing inside Europe and also in America and basically all over the world. So our aim is to create the best health for babies with a skull deformation. This can be done by, we think it's best to, the therapist can have an easy way to measure and that parents have a lot of insight in what the issue with their baby is. More about that later. And in the next 1.5 hours, you will hear everything about the app. If you have any questions, just drop them into the chat. I'm pretty sure that should be available for everyone. Otherwise, use the Q&A. Inside the webinar, we have some Q&A moments in which you can answer all of your questions. And I'm also very excited to see that basically from all over the world, people are joining. So for us, it's a good evening. So good evening, everybody. And let's start with the webinar. So today we'll cover multiple subjects. We start off with positional skull deformities, kind of freshen up about what research has been done, which measurements are commonly used. Second, we will cover the Skully Care app. Then we go through to the algorithm that the Skully Care app uses. So it's the CVAI and CI. Then we cover the validation and reliability. Those two subjects will be told by people who have done the research. And we finish by telling you how you can start using the Skully Care app.
Yes, and thank you, Freek, for your introduction. So I'm going to start to continue with a little refresh of our knowledge about skull deformities so that we're all on one page. Here we can start by taking a look at these photos. The baby on the right has an obvious head flattening, and the parents are very concerned and they ask, how bad is it? Can it still pass, for example? I am sure you recognize this. Parents, they can worry a lot, and what we notice in our experience is the thing that they want the most is clarity. How symmetrical a normal head is, you can see on the other side, on the left. In addition, in the middle, there's a child with plagiocephaly. You can see that the baby has been laying down more on the left side. And the growth of the head has slowed down, which forms a parallelogram kind. The child on the right, he has brachycephaly, and he is laid a lot more on the center line of the head, which has stretched the sides a lot. As a result, the head has become wider and has grown on the sides. These are various problems, but what leads to them is four factors that appear to have significant influence. First one is the position of the baby, intrauterine. The position is often a predictive value for the preferred posture after birth. Also a factor is the imbalance of the muscles of the neck, especially the sternocleidomastoid muscle. If the child moves less actively because of a certain delay they might have, then the baby will turn the head less frequently, which will later be turned into a side into a pro position. And we all know the factor, the influence of the prevention of sudden infant death syndrome. The parents are advised to let this baby sleep safely on their back, which is a very good thing, as this syndrome has declined, but in turn, flathead syndrome has increased a lot more. And then I think we can go to the, yes. So risk factors. When is the baby more likely to develop skull deformities? Boys are often more affected than girls. Premature born babies, twins, and first children are more likely to develop a flat head. We also see plagiocephaly on the right side of the head, much more than on the left. In your assessment and visits, always pay attention to the red flags, such as craniosynostosis, that's when the cranial seams are fused too early, cerebral palsy, visual and hearing problems. So in these cases, don't hesitate to refer to a pediatrician. And then I think we can go to the slide before. Yes, great. So about 20% of all babies in most countries develop skull deformities, which is something that we want to change. Plagiocephaly is the most common, happens when the children are about 2 or 3 months old. And brachycephaly also occurs most commonly at 6 months of age. The numbers on the slides speak for yourselves. How nice it would be that by measuring in an early stage, we can bring this number to a low level and prevent severe flattening. But the big question is, how do we objectify? How do we tell whether there's plagiocephaly or brachycephaly is present and that something is flattened? In the Netherlands, most therapists judge by eye. Not accurate at all. Some use the Argenta classification or the PCM, which is a method with a thermoplastic band. The Argenta scale is also used internationally to classify the locations. This one is used for plagiocephaly. First, there's only a unilateral occipital flattening. Type 2 shows the ear deviation. Type 3 shows the ipsilateral frontal bossing. And the most severe types have a change in the size of the orbita and sometimes a scoliosis in the face. We also see that sometimes that at the back of the skull has grown more up, the back of the skull has grown more upwards. And then we have the Argenta scale for brachycephaly. Type 1, again, shows a flattened spot around the occiput. Type 2, that the head had grown wider. And type 3, that there's also, that the front of the head has also grown more upwards. and it has grown more forwards, and the back of the head has grown more upwards. Yes, thank you. In order to find out how to help therapists the most, we asked them how we could aid them. And we have asked therapists what they think is important. Of course, we have good ideas about this, but we also wanted to be in touch with them and hear from them specifically. The question was, what do you see as an added value of a measuring instrument for babies with skull deformities? I'll list the top three. At 3, 1, that therapists can better inform the parents. This is the yellow bar. Secondly, therapists would want to have a clarity in size and number, so that they have a starting point to compare to. This is in the green. And at 1, which was definitely the winner of all answers, is I keep better track of the progress, and that's the line shown in blue. Over the past years, we have always talked to many therapists. What turned out to be needed is a user-friendly and accurate measuring instrument, an easy and quick method because we were already busy enough with treatments ourselves. On the vertical axis, the accuracy is displayed and the accessibility is horizontally displayed. We've put in this overview all the methods used. Top left are reliable methods. However, these require additional training or expensive equipment. Right under is very easy methods. They are unfortunately not very reliable. And this is why we developed Skully Care. Easy and accurate. Are there any questions yet? I think this might be a good time.
It is. So I have a question for you, Ellie. So I speak to a lot of therapists, and a thing that is mostly not known or not for everyone is so the baby lays in one position for a long period of time. Does that cause the head to be pressed inwards, or does it grow outwards? I don't know if you understand my question.
Yeah, I understand. Yes. The head flattening is actually not a really, it gives some, yeah, it's not a very clear word for it, but because it is only can grow outwards. So you can't press the head, the skull, and it doesn't go inwards, you know. So if you see a child or assess a child with head flattening, the flattened side hasn't grown that much. It stops there. And on other sides of the skull, the growth went faster. So therefore you see this asymmetry or brachycephaly. And to get the shape better, more symmetrical or more narrow, the head, less bright or less wide, sorry, then the child has to lay on other part of the head, especially the place where it has grown more. So then there will be less pressure on the flattened side, and there the skull will recover. So this is the way we look at this problem and how you can cure this. Yeah.
So I think also a common thing people think is that so Plagio and Brachycephaly needs to be resolved in the first year. It's often thought of as that the skull has hardened after 1 year, but that is probably the 1 year time period is probably because of the growth, right? So yes. After 1 year, there's less growth.
Yes.
So okay, yeah.
After 1 year of age, the skull grows not that quick anymore, but we see especially the brachycephaly recover still until 5 years old. So if there's a brachycephaly, you can see a better result after 5 years, and the plagiocephaly after 1 year or 2 years, then it will remain the same almost as a child will be 15 years old, like that. Yeah.
Okay, interesting. So let's see if there are any questions. I see one question about how long does it take to receive the results? We will answer it indeed in the presentation. But yeah, so with Skully Care, you can conduct a measurement with taking a photo. That photo is sent to a server and you receive the results. You always receive the results within 5 minutes, but only during working days. And that highly depends on where you are located. So in the Netherlands, it is between 8 in the morning and 6 in the evening. We will guarantee you'll receive the results within 5 minutes. Without that, it will take, sorry, not without, after that, it will take longer. But if you join, then we will just send you an email explaining at what time frame we will receive. We will send out the results fast. Yeah, so the time zone in the Netherlands is, I think,
Yeah, so we use Central Eastern Standard Time, summertime right now. We'll switch to wintertime soon. But Central Eastern Time is the, Central European Time is the time zone we use.
Yeah.
And that's +1 GMT.
Yeah. So. Yeah, I don't think there are any other questions. So if you have a question, just drop it into the chat. Also about the previous part or other things, then we're happy to help. And let's continue with the webinar. So we will start off with a video about explaining what Skully Care does. It's pretty global, but it gives a good insight in the advantages of Skully Care.
Meet Ellie. An important part of Ellie's work is to help babies with Plagio and Brachycephaly.
Sorry?
She strives to provide the best care for her patients. To prevent skull deformations from worsening, Ellie needs to measure the effectiveness of her treatment. She can do this by tracking how the shape of the baby's head changes over time. But current methods are very time-consuming and not accurate at all. It's time for something new. This is where Freek comes in. The idea? Combining photo analytics with AI and putting it in an app. It's easy to use. Just measure with one photo and you'll immediately receive the results, giving you and the parents a clear starting point for treatment. And it saves a lot of time. Use the app to share the whole treatment plan, so parents can practice at home. The Skully Care app is used by many therapists in the Netherlands, and we would like to invite you to do the same. The only thing you need is a toolkit. Skully Care, the flat head assistant. Meet Ellie.
So yeah, that video gives you a nice global overview about how the Skully Care app works. The map which you saw is a bit outdated. If you take a look at it right now, it will be all purple marks. And also if you zoom out, you can see all the places where Skully Care is used. So you saw it in the video shortly. But with the Skully Care app, you always need a toolkit to measure. Inside the toolkit are 3 caps. The caps are used to compress the hairs, so it doesn't interfere with the measurement. Also inside is a mat, which allows you to measure at any place or at any, so you can measure on a table or on a bank or couch, sorry. And also there are ear spreaders. These are foam bits that you can place between the skull and the ears. So if you have a baby with very narrow or close ears to the skull, then you can just widen them little. This will help you conducting a measurement. So how do you take a measurement? It starts all with taking a photo. Before you can take a photo, you need to put on, use the cap. The cap needs to be on the eyebrows and in the ears, or between the ears and the skull. Next, you lay the baby on its back, and you place the mat underneath the head. And then you are ready to measure. By measuring, you need to be sure that you take a photo containing both ears and the tip of the nose. And this is the only part that you need to worry about. Inside the Skully Care app, there are a lot of functionalities to help you containing that correct image. For instance, the app is always zoomed in, which allows you to step back a little bit, and that higher chances of making a photo that contains both ears and the tip of the nose. Also, there's a burst function. So if you take a photo, there are taken 5 photos in a short period of time. So babies move a lot, and this function allows you to, if a baby moves, to select the best photo afterwards. So now you have an image of, or you have positioned your phone in which you can see both ears and tip of the nose. So you take the photo, and then you add the photo to a new or existing baby. So underneath you see all the existing babies which you have measured before, and otherwise you will just add a new baby. Then the photo is sent to a server, and on the server we calculate the degree of skull deformation. The results will be sent back to you within 5 minutes during working days in Europe, and this is what it looks like. So you receive a push notification. If you click on the push notification, then you go to the baby, and you see the image and the results. So the results are calculated with 2 values, the CVAI and the CI. I think probably most of you are used to these values. The CVAI says something about the Plagiocephaly, and the CI says something about the Brachycephaly. One important thing to know is that these images are always being checked by a person. So we have a team that checks all the images to see if they are correctly calculated. One big advantage of measuring with a digital method is that we plot all the measurements in a graph automatically. This gives you and the parent insight in the progress. Here you see 2 graphs, one for the CVAI, so the top one is for the Plagiocephaly, and the second one is for the Brachycephaly. We notice that this is useful for the therapist, but also very useful for the parent, because you give them clear insight in what the progress is, but you can also motivate them more to reposition or to wear the helmet more. One thing, the app is a bit orientated on on repositioning, because that's the most common way to treat babies with a skull deformation in the Netherlands. But we also have many clients who use it with babies who are helped with a helmet. Still, the graph is very useful. And the third thing the Skully Care app has is you can share all the measurements, the progress, and exercises with the parents. You can type in a message and you can select exercises which you think are useful for the parents. The exercises are short videos created by Skully Care, in which parents can so parents can take a look at them. If you share it, only the exercises will be shared that you have selected. We see that if you go on consultation to the parents, then the parents can receive a lot of information. And with the Skully Care app is a really easy way to just quickly select exercises so parents can recap what you have said during the consult, so they don't forget about it. So sharing with parents is for free. These are a couple of exercises that are used in the Skully Care app. One important thing to notice is that all the whole app is in English, or in, I think, in 16 different languages. So nowadays the Dutch are shown, but we have a lot more. For the parents, the Skully Care app looks like this. They only see their own baby, and if they click on it, they see in parents-friendly text, or in a parents-friendly way, we explain what situation is. So we don't say a severe skull deformation or Plagio and Brachycephaly. We use like more common terms for it. You can share the Skully Care app with the parent using a QR code. So you just, as a therapist, you have the app and you fit in the phone number of the parents, and then a QR code is shown. The parent scans the QR code from the therapist's phone, and then they automatically open the Skully Care app and they only see their own child. We also have another function. So if you are treating babies that are like really far away from you, you can also invite parents to conduct a measurement themselves. And this measurement is sent to you as a therapist, and you can just walk through it, give the parents a call, or go on consultation. But then you have the measurements in advance, or you don't need to travel all the whole way. And I think, yeah, there are more functions inside the Skully Care app. So you can generate a PDF file for your electronic health record. And did I forget something? I think that's it. There we have also on the Skully Care website a virtual treatment room. So we would like to invite you to try the Skully Care app yourself. I can imagine that you don't always have a baby and toolkit near you. So that's why we have created the virtual treatment room. We have created a video. You open the video on your desktop, you click on play, and then there's a baby with a cap on and a mat underneath. And we challenge you to grab your phone and take an image of the baby's head. And you have to beware, so both ears and the tip of the nose needs to be on the photo. So are there any questions?
We have a few questions in the chat.
Mm-hmm.
The first one being, how are the baby's details data collected?
Yeah, I will answer that one. So the details that we collect from the babies, or that you need to fill in from the babies, are the first name and the first letter of the second name. This is done on purpose so that we don't collect any personal data, but it is enough for you as a therapist to recognize which baby is which one, or which did you measure. Second, that it's very useful is the birth date. The birth date is used in a graph, so you have like all the measurements start at the right point. If you are not comfortable with sharing the exact birth date of the baby, you can just switch 3 days advanced or 3 days back. So you have a 6-day window, and we don't collect the exact date. And there are a lot of, so there are 3 more options. We ask if the baby has born premature, if it's a twin, and that's it. And we gather this information to do extra research. So basically trying to figure out if there's a pattern in which we can advise you as a therapist to be more careful about Plagio or Brachycephaly.
Then Julie asks whether it's possible to use unique IDs instead of details.
Sorry?
Julie asked whether it's possible to use unique IDs instead of details. So, for example, if instead of writing down their name, they could write down the neural.
They can, yeah, or you can also give them a number or something. So the name is only for you to recognize which baby is which baby.
There's a question about how available the app is in the US.
Yeah, that's a good question. Yeah, so the Skully Care app is downloadable, I think, in most countries, except some countries. But I think everyone here should be able to download it. We have a slight issue with customers in the US and Canada. For security, we send out an SMS verification code to enter the Skully Care app to make sure that you are you and not someone else is logging in. With the US customers and Canada customers, we have sometimes trouble sending out this SMS. So if you would like to join the Skully Care, if you'd like to try it out, or just download it and see what it has to offer, please send us a message. Then we will create an account for you, and we make sure you can just log in whenever you receive the SMS verification.
And then Sophie from Vancouver also asks if we can get the ODD measurements.
Okay, Ellie, I think this one is for you.
Okay, so you're familiar with the PCM, I think, because the ODDI didn't read it, but where it was. You mean the PCM, I think. The ODDI is is inside the PCM measurement method, but worldwide most of the measurements are they use the formula of the CVAI. So it's a little bit, if you are familiar with the PCM, then you have to sort of get used to the other way, the other formula, like the CVAI. But inside the app, there's a lot of explanation about it. And later on, Katrina will tell more about it, how it works and what percentage is normal and what, all about it, yes.
Yeah, I'm not sure she meant the ODI, O-D-D-I. But if you mean something else, just drop it in the chat, then we will answer the question. So I also see a question from Samantha. If you need to have a good bandwidth, I think bandwidth means you mean the internet connection. So the Skully Care app works as follows. There are no personal or health information stored on your phone. They are all stored on the server. If you open the Skully Care app, it will load the information from the server to your phone temporarily. So to use the Skully Care app, you need an internet connection. I don't think it needs to be that good, but you need somehow a Wi-Fi or internet connection. Okay, Katarina, did you see any other questions?
Well, we have a question on do we require consent for extra research on babies?
Mm-hmm. So Ellie, do you know how that works?
I didn't hear it.
Sorry.
The question?
The question was, do we require extra consent for extra research conducted on babies?
Consent? You mean research about the Skully Care app?
Ja, ik denk dat ze vraagt, Ellie, talk in Dutch now, of je toestemming nodig hebt van de ouders om dat wij onderzoek doen over baby's.
Yeah, during the research we have done, we had consent of all the parents, of course. And if we use the data who are in the app, if we use it without name or any other information, like anonymously, then we can use this data. But for real research, like we have done on the validation and the reliability, we had consensus for all the parents.
Yeah. And I also see another more information about the ODD. So it stands for oblige diagonal difference. I don't think I pronounced it correctly. But this is if we calculate the plagiocephaly in millimeters or in a distance. So Skully Care doesn't do that right now. We only calculate the CVAI and the CI. Sorry, but we are working on a way to extract the precise amount of millimeters of Plagio and Brachycephaly.
Because we use photo imaging, we have to index the outcomes, because when you have then it's more reliable. So we can't really like Freek said. So indexation is is sort of important when you use photo imaging.
Yes, that's correct. I see a question about if the heads are washable, and they are. Also, the heads are one size fits all. So you have 3, which should basically fit on premature babies until, well, I even had one on myself, so until 30. So that they should be good for that. Yeah. And I also see a question about the data protection. So we spend a lot of time on this subject, and the Skully Care app is GDPR proof. So that means that all the data protection is covered very well. The server is based in Germany, and it's also very good protected. The Skully Care app is also very good protected using a PIN code or facial or fingerprint recognition. And as mentioned, the Skully Care app is designed with the principle of privacy by design, which basically means that we don't collect any personal information or small bits, but that is impossible to trace back to the specific patient. All right. Are we done with questions, Katarina? I don't know if you have an overview about that.
I think with that we can continue on.
Okay, perfect. Yeah, so how does Skully Care determine the degree of flattening? So during the Q&A, we give slides answers. But how does Skully Care works? In the photo, you see a baby with an obvious Plagio and Brachycephaly. The cap the baby is wearing ensures that the contours of the head are clearly visible. The ears and the tip of the nose are important on the photo. They are starting points for line 1 and 2, and also for B and L, as you can see on the photo on this slide. For plagiocephaly, lines 2 and 1 are important. In this photo, you can see that line 1 is longer than line 2, and and how much longer line 1 is determined by the Skully Care app. The CVAI, so the comparison between line and 1 and 2 has been calculated, and then the result is known as the CVAI, and the CVAI has developed by Loveday in 2001, and it's basically internationally the standard of determining the plagiocephaly. And for the brachycephaly, the head is too wide. That means sorry, go back one slide. That means that the lines B and L are compared, and the ratio between them is determined. That is being calculated and it's called the CI. So first, the CVAI, it consists of a 5-point scale, so 5 levels. The scale ranges from 0 to 11, more than 11%. At 0, everything is perfect, but the higher the CVAI, the more severe the flattening. We can do a little, poll. So how much do you think that this baby's CVAI is? Please drop it inside the chat. You can drop in the exact percentage if you are really a pro, or just give us the mild, moderate, severe, or normal value. For the CVAI, we just take a look at line 1 and 2. So please drop in how high do you think the CVAI of this baby is? So I see someone moderate, mild. Oh, I need to. Yeah, a lot of mild. Mild.
4 milds, 1 moderate, 2 moderates, 3 moderates, 5 milds.
So it's now 5 against 3 mild or 4 mild.
Yes, that's correct.
Okay. Now, so I will just continue, and so the CVAI of this baby is 7.8. So it's a moderate flattening. So yeah, it was quite close. Next, we will talk about the brachycephaly. For brachycephaly, we use the CI. An ideal is an oval shape of the head. The CI is then 80%. The scale of the CI starts from less than 70%. Then the baby is the head is very narrow. as you see often in premature babies, and it ends at above 100%. Then the head is very wide. One very thing we always say is you have to look at the mother and father because the shape is highly dependent on the ethnological variations of the parents, and this only is you only need to do this with babies with a brachycephaly. Now we have a poll again, so please drop in the chat what amount of CI or the moderate or value do you think this baby has? So you can type in the percentage or the mild, moderate, severe, very severe. And then in this case, you need to compare the line L and B with each other. Also, a good thing is that, or some extra information is, you see here the formula in which the CI is to be determined. So the width is divided by the length, and it's multiplied with 100%. So if you're really quick, you can just grab a measurement tape and just tape it and put it in the calculator. But I think we have enough answers. So Katarina, do you have an update?
Yes, we have 8 people who are saying moderate to severe.
Okay. So this baby has a CI of 101.4%. So this baby comes out in the severe to very severe scale.
Maybe I explain a little bit, because I have to go to this one. Line B is a little bit longer than line L. So that's why it's a little bit more than 100%. And that's on the severe flattening. That's why, yes.
Thank you. So for people who don't know the CVAI or CI, this could be a lot of information. The good thing is that inside the Skully Care app, you see the description and an information icon to the right. If you click on it, you go to our website, and there we explain a lot of details and examples how the CVAI and the CI works.
And with that, we can go to the validity study. The validity study is conducted by Dr. Liam van Alderghem, who is a plastic surgeon and an expert in craniosynostosis. Now, this was an external study conducted, once again, externally and not affiliated with Skully Care. However, he did look at Skully Care. Dr. Alderghem recently developed a 3D measurement method for craniosynostosis with craniofacial hair, and he also has countless of publications. And this study was carried out with the University Medical Center of Utrecht. And here we have a little video where he explains his research in detail.
I would like to present to you the validation of the Skully Care application as a quick and child-friendly method for measuring positional cranial deformities. Positional cranial deformities in newborns and young children is a common problem in daily clinical physiotherapy practice. Plagiocephaly and brachycephaly are often seen, Positional scaphocephaly is rare and related to premature birth. Differential diagnosis of craniosynostosis is of utmost importance. Primary diagnosis of positional cranial deformities is based on clinical history taking and physical examination. Quantification of severity is more complicated. The Argenta classification is a visual assessment and therefore subjective and not quantitative. Caliper measurement is frequently used in the clinical setting and is objective, but the inter-rater reliability of caliper measurements ranges widely between studies. Due to the aforementioned limitations, plagiocephalometry was introduced in 2005. In plagiocephalometry, a thermoplastic strip is positioned around the infant's head at the widest transverse circumference. The method is reliable and valid compared to 3D CT scanning. PCM proved the value of physiotherapy in treating positional cranial deformities, and it proved that helmet therapy has no value. PCM can be seen as the gold standard. However, the method needs direct skin contact with a thermoplastic strip, is laborious and time-consuming. In PCM, the oblique diameter difference index scores the severity of plagiocephaly. The cranial proportional index, the severity of brachycephaly. Skully Care was developed as a faster, user and child-friendly craniofacial measuring method. Skully Care analyzes skull shape by using a standardized photograph from above in an application on a smartphone. This photograph is analyzed digitally and both shape and severity of the deformity are established. A clothed skull cap is used to compress disturbing hair. In Skully Care, the cranial fold asymmetry index scores the severity of plagiocephaly, the cranial index the severity of brachycephaly. The aim of our study is to validate Skully Care as a craniofacial measuring device by comparing it to PCM. Validation is performed on children younger than 1 year of age, referred for positional cranial deformity in pediatric physiotherapy practices. Duration of measurement was compared in both methods. 60 skull shape analysis in children were included. To be eligible for inclusion, PCM and Skully Care had to be performed. ODI was compared to CVAI, CPI to CI. Duration of measurement was analyzed in 10 children. Pearson correlation coefficient was used to determine correlation between CVAI and ODI and between CI and CPI. Mann-Whitney U-test was used to determine the difference of time consumption between PCM and Skully Care for the making phase, for the analysis phase, and for the total procedure. For illustrative purpose, the comparison of the severity scales was performed. A high correlation was found between ODI of PCM and CVAI of Skully Care with a p-value of less than 0.01. A very high correlation was found between CPI of PCM and CI of Skully Care with a p-value of less than 0.01. The severity scales were compared for positional plagiocephaly and for positional brachycephaly. When comparing the modified CVAI with ODI, a complete level match is seen in 62%, a one-level difference in 38%, and no difference of more than one level was seen. When comparing CI with CPI, a complete level match is seen in 73%, a one-level difference in 27%, and no difference of more than one level was seen. VCM measurement took significantly more time than Skully Care for all phases. 13 versus 2 minutes for making, 16 versus 2 minutes for analysis, 29 versus 4 minutes in total. We can conclude that Skully Care is valid and fast. Skully Care has potential to be the modern successor of analyzing positional cranial deformities. Thank you for your attention.
I see there are two questions. Sorry. Yeah. So one question is: are there any plans to make the results faster available in the North America? So there are definitely plans, but this depends how many therapists or users want to join from America. I'm pretty sure if that's our reasonable number, that we can also send the results back within 5 minutes in North America. So basically for now it will be longer, and within hopefully a fast period of time it will be as the same quick as the Netherlands or Europe.
I believe that was all the questions for now.
Oh yeah, correct. Okay.
So that was the reliability study, which found out that Skully Care is a valid, rapid, and modern successor for quantifying positional skull deformities. With that, we can move on to the validity study, I believe. Oh, sorry, the reliability study. Sorry,
Yeah. Yeah.
That's on me. Okay, that was the validity study, and now we can continue on with the reliability study, also done externally, thanks to Sophie Meyer, who completed her master's in pediatric physiotherapy in the Netherlands, and she worked together with the University of Applied Sciences in Utrecht to conduct a study on the reliability of the app.
Cranial deformation in infants occurs as a result of postnatal or prenatal forces on the growing skull. When infants have a preference for turning their head to one side, 75% of the time, it's called a postural preference, and this can cause a deformative plagiocephaly or brachycephaly. Carefully measuring and objectifying this kind of skull deformation is important for early intervention by pediatric physical therapists. Most current measurement methods for objectification of skull deformation are less accurate, expensive, and or time-consuming. Now there's a new app called Skully Care, and this smartphone application is used to objectify skull deformation. We know from a previous study that Skully Care is valid and the measurement is quick. Within a few minutes you have the measurement ready and the results back. The reason for this study was to examine if Skully Care is reliable too. This study called reliability of using a smartphone application to objectify skull deformation. How works Skully Care? The child must lie on his back on a flat surface, and then the therapist puts a cap on his head, which makes the contours of the head clearly visible. Then the therapist makes a photo of the head in which the tip of the nose and both ears are visible. The app calculates the cranial fold asymmetry index and the cephalic index. We did it by organizing 3 measuring days, whereas we measured 30 infants by 3 raters. Each rater took 3 photos of each infant in turn, always in the same order and without seeing how the other rater took the photo. Then we asked one of the parents to take a picture as well. This was to explore the degree of agreement or correlation in outcome between their measurement and the measurement of the pediatric physical therapist raters. We compare the outcomes of the Skully Care app measurement using the ICC. All of the ICC values were higher than 0.95, what is excellent. We also calculated the SEM and the SDD, which are low when you compare it to other measurement methods, meaning the measurement error is low, what makes the app more reliable. The Skully Care app proved to be valid, quick and reliable when used by pediatric physical therapists, but there are some recommendations for further research. The most important one is that we want to know what the responsiveness is of the app. The app tells the therapist more about the severity of the skull deformation, but you also want to know by a second or third measurement if there truly is an improvement. And this requires a responsiveness study. In addition, it will be relevant to investigate the usability of the app for other professionals, because it can be very interesting and time-saving for other healthcare professionals. Thank you for watching this video abstract. We hope you will enjoy reading the article.
So the article of Sophie was published, I think 2 months ago, in the Ellie, could you help me which article it was, which
Yes, of course, which, yeah, what you call it? And it was published in Pediatric Physical Therapy. Maybe you read it because it's common read by therapists in the US and in Canada and in the UK, I think, also in the Netherlands. So we're very proud that this study has been published in July of this year. Also, the study of Leon van Adegem about the validation is published. That was last year in 2021. It was published in Cleft Plate Craniofacial Journal. So if you go to PubMed, that is open access article, so you can read it all. But the reliability article of Sophie Meyer, you only can read the abstract. And if you are a member of the pediatric physical therapy, you can read it totally.
Yeah, what we will do is after the webinar, we will just send you a link in which you can watch the webinar again, if you would like to. And also we will include the article of Validity. And send a link to the reliability study so you can just take a look at it yourself. Are there any questions? Don't hesitate to drop it into the chat. I think we covered it for now, so please drop it in, then I will answer it. We will answer it. For now, we will continue. I think to the last slide. Yeah, so we started off this basically this webinar explaining you a bit more about Plagio and Brachycephaly, a bit of a freshen up, and hopefully explained why you as a therapist could use a new measuring method. We would really like you to join Skully Care. The app is really friendly, it's really easy to use. You can just download it in Skully Care in the Google Play Store and the App Store. Also, if you start using the Skully Care app, there are a lot of feedback functions in which we help you on board. One of which is if you take a measurement that is incorrect. For instance, if you don't have captured the right eye on the photo, then we will give you an instant feedback explaining what is wrong and how to improve it. So if you take a photo and you see show feedback, if you click on it, then you just show what's wrong and you can improve. To join Skully Care, you first need a toolkit. As mentioned, in the toolkit there are 3 caps: ear spreaders, a mat, and there's a folder explaining you as a therapist how it works, but also explaining parents how it works. And the toolkit costs €37.50, exclusive of VAT and shipping. VAT is 21% in the Netherlands and also worldwide, and shipping is between 6 and I think €12. The toolkit is a one-time investment, so you basically we are working now for 4 years. I think the longest therapist, the earliest therapists are now measuring for 3 years, and they didn't need a new cap or mat or something, so this should be good for a long time. The second thing you need is a subscription with 2 options. The first one is a basic subscription. This is a free subscription, so it doesn't cost anything. But there are some disadvantages, of course. The first one is you can measure once per 2 months, and you get the results not within 5 minutes, but within 2 days. We have created this subscription for companies who have 3, for instance, 3 therapists which measure a lot, and then you have 1 therapist who sometimes replaces a sick therapist, and that one can just use basic, so we don't charge anything for that. The second one is a professional subscription. You get all the functionalities that we mentioned before, so you can measure a limited amount of times. You get the results back within 5 minutes in the office hours in Europe. I think if you're based in America, then you will at least get the morning all the results within 5 minutes, and in the afternoon a bit longer. You can share the Skully Care app for free with parents, and you can measure remotely. And of course, you need a toolkit. So I think during this webinar, you have had all the information that you need to start using the app. For the webinar, we have a code, which is Skully11-10. And with this code, you can use the Skully Care app for 2 months for free. This is just a period for you in which you can determine if you think the Skully Care app has the same values as we told you today. If you want to join, you can go to skullycare.com and click on I want to join. While registering, please fill in the code, and we won't send you an invoice for the subscription for 2 months. After 2 months, you will receive an invoice. If you are not happy about it, or if you want to change your basic, please let us know. Then we will cancel the invoice, and we can just continue. I think that's all. So what you also could do is go to skullycare.com and visit the virtual treatment room. There you can measure a baby yourself. And I see there is one chat. That was the question. And now we have come to the end of the webinar. We also will include the promotion code in email, and it's valid until the 25th of October. Thank you a lot for watching tonight. It gives me, as a co-founder of Skully Care, really much good motivation to continue with Skully Care. We have a lot of many more ideas how we can expand Skully Care. For instance, measuring craniosynostosis, which is a pretty severe disease, and we are working on it right now. So we would love you to join, and hopefully we can journey together with creating a beautiful app. And if you have a question, just drop it into the chat. Then we'll keep answering it. And for now, have a nice evening, or morning, or midday.
Hi everybody, and if you have any questions, just send us an email, and we will answer all your questions. And you can still, put your questions in the